Excellent. So welcome to our segment today on AIDS, Art and Memory, Reflections on Then and Now with Anita Vitale. Anita was friends with David Wojnarovicz and Peter Hujar and many other people, and was front and center on the early days of the AIDS pandemic. And it's my great pleasure to welcome her to our course and to her contributions for this module. Anita, would you like to say a little bit about yourself?
Yeah, I really welcome the chance. It's been many years. I started working with people with AIDS in 1986, so it's been quite a while. And this has given me an opportunity to reflect on it. The coronavirus epidemic has brought back many memories of how things were. And so this has given me a chance to put things together and to hopefully enlighten people as to how it was during that time.
Well, I appreciate that. And I know that it can sometimes be emotionally challenging to revisit memories that of particularly traumatic events. So I really appreciate your sharing those with us.
Thank you.
Do you want to maybe start with, let's see, maybe start with your history with HIV/AIDS, the pandemic, and what you did and what you saw in those early days.
Well, in those early days, actually the first case of HIV of AIDS was probably diagnosed in 1981. And my program started in 1986. So clearly 5 years after people started having great needs and getting very sick. And as you look at the history of the epidemic, you'll see that the delay in people recognizing what was going on led to many delays in services, in health-related matters. And I'll just go through a few things, actually. HIV, while the first patient was identified in 1981, HIV wasn't identified as the cause until 1984, which meant that that period of time, there was no way of dealing with it. The first diagnostic test where you could find out if you had antibodies was not approved until 1985, and another test in 1987. So again, these scientific delays led to people just getting very, very sick and dying, getting opportunistic infections that people hadn't really heard of in years, and probably in this day and time, people don't know about either. Names like PCP, pneumocystic pneumonia, cytomegalovirus, these very gruesome infections that basically just killed you. That was it. And so we finally caught up a bit in 1986. And in New York, the impact was extraordinary. There were, since the populations affected mostly by HIV, I probably should stop and just talk about transmission, Richard, I guess.
Okay, that's fine, sure.
I'm ahead of myself here. Okay, I guess I can do that again. When we talk about the nature of the disease, we talk about several things: how it was transmitted, the populations affected, and how it killed people. And the transmission was really, it was kind of hard to get AIDS. It had to be direct, and it had to be direct contact through blood or blood products or semen. So it wasn't like it was in the air. It wasn't like COVID where, you know, the general population can just get it. It had to be very direct and through blood or semen. So of course there was a very specific population affected, and it was men who had sex with men, IV drug users, women who were sex partners of men infected. Initially it was hemophiliacs because the blood products were infected and hadn't been screened properly. And it was also children born to HIV-infected mothers. The virus killed, and it was a death sentence initially. There was no treatment. It attacked your CD4 cells, which are your, which basically protect your immune system. So that's when people develop these opportunistic infections, Kaposi sarcoma, a particularly terrible kind of cancer that basically disformed people. PCP, as I said, and AIDS-related dementia. It affected young people. So to see AIDS-related dementia in someone 25, 35 was quite horrifying.
Right.
It was immediately, had a disproportionate impact on people of color, men and women, and also gay men. While it became the leading cause of death in people aged 25 to 44, it accounted for 23% of all deaths among men, but 32% among African American men. And the third cause of death for women aged 25 to 44, but first among African American women. And we see that again in COVID today, which disproportionately affects people of color and actually people who are poor. It exposed our society for not being able to care for these people. They lacked health insurance, they lacked adequate housing, they lacked just means of taking care of themselves. When you're well, you can kind of put together a life. You can find a place to stay, perhaps. You can have 3 or 4 jobs. You can do that kind of thing. Once you get sick, you're just not able to do it anymore, and everything falls apart for you. So again, we see the same kind of thing happening that happened with the AIDS epidemic and is now happening with COVID. The mantra, again, no treatments at all. No treatments at all. They learned how to, and again, as with COVID, they've learned now how to treat the symptoms. They've learned how to treat people better on, instead of with intubation, perhaps some drugs to alleviate the symptoms and what people are going through. The deaths have become less, even though the infection rate has skyrocketed. For AIDS and HIV, they learned how to treat the opportunistic infections. But some of the treatments were so horrible that people couldn't tolerate them. We called one treatment shake and bake, because when you got it, it was this drug called amphotericin B. People would just shake and their fevers would go sky high. So it was very difficult to save people even with these treatments. There was no antiretroviral treatments, ART as they called it, until the mid-1990s when drug trials started and people started taking a cocktail of 3 different kinds of drugs together. And that was not, again, until the mid-late 1990s. That was more than 15 years after the start of the epidemic. And to this date, there is no vaccine for AIDS. There is, the drugs work in the United States. There are still people who don't have access to these drugs, and around the world, there are people who don't have access to these drugs. So the death rate, as you can see, still continues. Each year in the United States, there are at least 13,000 deaths or more, and a cumulative amount over the past 30 years or so of 770,000 deaths. Now, Peter Staley, I do like to quote him. He's an HIV/AIDS activist, And he was raging against the Trump administration's initial response to the epidemic. And it enraged him because he reminded him of the Reagan administration's indifference. And he said, this is his quote, "Over the next 9 months, we're all going to know people who will die. We're going to have compacted into 9 months what we went through over 15 years in New York City." And that's what we're seeing now with the coronavirus. The numbers are staggering, and there doesn't seem any national will to do anything about it. We're repeating ourselves, and we just get into this. What I also noted with the coronavirus epidemic and the AIDS epidemic, there were mantras. Because there were no treatment, people were told to change their behaviors. So for people with AIDS and HIV, you were told to act as if you're positive. Even though you couldn't know, in order not to spread it to someone else, act as if you're positive. Practice safer sex. Use a condom. I always say now that the condom are now the masks of today's COVID. You know,
Absolutely. It's like we've gone from covering up one thing to covering up another.
Exactly. And then harm reduction. For people who were injecting IV drugs, it basically was trying not to share needles. Needle exchange programs started up that so that people could get clean. You couldn't change the actual behavior, but you could change what went on with it. So a lot of drug treatment programs started giving out clean needles. I should say there was an outbreak not too long ago in Indiana when Mike Pence was the governor, because he would not allow any needle exchange programs. And there was the infection rate rose precipitously in HIV in his state. So we know that these things work. There was also, it was very interesting, until the AIDS epidemic, people didn't routinely wash their hands in hospitals when they examined patients. They would, doctors or nurses, or, they'd go into a room, they'd do what they did, and they didn't wash their hands when they went in or they went out. So they instituted universal precautions, which certainly today we're told, wash your hands. Just don't touch your face, that kind of thing. And that was what the AIDS epidemic really led us to, because people were afraid of touching people with AIDS. They were afraid of contagion.
Right.
So it was a hard time at the beginning.
What I find so fascinating is that this pandemic does have echoes of,
yes,
COVID has echoes of the HIV/AIDS pandemic, but there are some very notable differences, and part of it is a sort of social and moral
yes,
equation that you got HIV/AIDS because of social or moral legacy, whereas COVID is just sort of innocently attacks people.
Yes, right. It's there in the air. You're doing it. You're breathing it in. You're not bad if you get COVID.
Right.
But certainly when we look at the response of, society and government and institutions, I kind of lumped it into three different things: indifferent and uncaring, and that was certainly at the beginning; actively hostile, as the people who came down with this disease were judged and were discriminated against. And then another term that I actually just recently heard, discriminatory animus, which I thought really described how people were treated. And for my friend, the artist David Wojnarovicz, he called it murder. He said the government contributed to the murder and to the disappearing of all of these young people who contracted HIV.
Anita, sorry, I don't mean to interrupt you. I find it so fascinating that, if we look at the time frame you're talking about, mid 80s and onwards, and now, that many of the same characters, or I'm sorry, actors, if you will, are reappearing in some form or another. You mentioned Mike Pence and his connection to the spike in HIV infection
Yes.
in Indiana, or I think of Roy Cohn back in the day, who mentored Donald Trump, and we have
Yes.
today, or like Anthony Fauci, who has experience and has sort of leadership activity in both the HIV/AIDS
Yes. Right.
and now. So it's sort of interesting from a social political perspective how these things are impacting us, and that they're the same people.
Yes, yes. Those who are alive still, yes, the same people with their same attitudes, and they haven't changed. They haven't changed.
Yeah.
No.
I also would like to take this opportunity to tell our listeners that we also have links to some of the early government responses to AIDS on our module about the 1918 flu pandemic and AIDS pandemic with Philip Clark and Christopher Bram. And I can actually repeat those links here, where there were press conferences and press conferences where people were laughing about people who had HIV/AIDS because it didn't. Are you, implying that, well, no straight man's going to get HIV/AIDS, so why should we worry about it?
Right.
So sorry, Anita, I didn't mean to interrupt.
That's okay. It's so true. I mean, that's how it was. There was, when I worked in city government and had just started to run the program, my boss and I were meeting with this attorney who was, a decent man, a straight, decent man. I had nothing to hold against him. And what he said was, with a grin on his face, well, why don't we just put all these gay people on an island and let them fuck themselves to death? I mean, that was from, it was a prevailing kind of attitude that it would go away if you could just get rid of these people. And that's what I feel was the pervasive governing force early in the epidemic.
Yeah. I'm sorry to say that I'm not entirely convinced that attitude has disappeared.
Yes, right. Right.
Right. Anita, I wonder if you feel it's a good segue, if you'd tell us a little bit about how you got involved with your position and why.
Well, it was, I was working in procedures, which, you're concerned with semicolons and, sentence structure. But I had done, a lot of casework with clients before that. This was kind of like an administrative job. And through a friend, I heard about a position that would be opening. The city, Mayor Koch, had finally decided, after great pressure from the gay men's health crisis and a crisis in the hospital system and growing homelessness, to fund a program that would help people with AIDS. And they wanted someone to be the director, and were hiring also staff who would basically be caseworkers who would have caseload of about 20 clients, people with AIDS, and would help them get anything they needed, ranging from public assistance money to housing to home care to whatever they needed. And it could cut through the red bureaucratic tape. Well, when I said, oh, I'm very interested, how do I apply? And my friend said to me, well, you may not even you'll have to apply, but it may not even matter because no one wants the job.
Wow.
Everyone was so afraid of transmission that no one, except for a few, wanted to work with this population.
And so, Anita, why were you not afraid? What?
Well, I had done reading. I have to admit, New York Magazine had an extraordinary article about, HIV, and well, it wasn't even HIV then, it was called GRID. You know, gay was, it was called after gay men who seemed to be affected by it. I had many gay friends. My friend Tom, my best friend in the world. I weighed the risk and I thought about it, and I didn't feel that I would be placing myself at risk.
Mhm.
And if I were, we'd figure it out. And I really wanted to do it. I felt it was something more meaningful than anything else. Not that I'm an angel, and I don't like people to say that to me, which they have over the years. I just felt, and I also relished the idea of cutting through bureaucratic red tape. That made me very happy.
Well, I am sure that I and many other people appreciate you for that.
So that's how I came to the AIDS program. And we had all the caseworkers, you know, mostly caseworkers are assigned through a civil service list, and they're assigned to their jobs, regardless of what they're interested in. But we interviewed caseworkers, and they had to want to work with this population. Many of them were gay men themselves. We were able to hire, the list was coming to an end. We were able to hire people who just applied for the job. And again, they came from the same community. They wanted to give back to their community. They wanted to be part of helping. So we had a really committed staff who cared desperately about every client that they saw. And I'm sure we blurred, in many instances, the casework, you know, formal relationship with friendships. Because when you're working with people who have limited time to live, who are so desperate, you would often be out late at night. You'd visit people in the hospital. You'd be there when they died. You would arrange their burials. Their families didn't want to know them. One of the sad things of this epidemic was that these were, particularly among gay men, they had left their families in other areas, the Midwest, the South, wherever, had come to New York to find themselves, to realize their dreams. Their families did not know they were gay. And often when they found out they were dying, they would come to see them. But the first barrier they had to get through was that they were gay.
Right.
And that often was a very hard thing for them to get to, even harder that their son or daughter was dying. It was quite, you know, remarkable to see that. So often,
because so many of them were so young.
And so young, in their 20s, their 30s. That was the majority of cases. They hadn't even, you know, their lives were just starting. It broke your heart. And we also saw young women with children who, you know, because of sex with their husbands, boyfriends, were coming down with AIDS. They were going to die, and they would leave children. So we had to do a family program to, you know, for the future of these children and prepare for that eventuality, because nobody got out of this alive initially. You didn't. We could see a person would come to us one day. People would, you know, they were able to walk in. It wasn't that they were in hospital beds just dying. People were ambulatory, walking in. They would spend hours in our offices just for human contact. And you'd see them, and you would see over, it could be one day or it could be a couple of months, but you would see them change, and you would know that death was coming. It was very hard for us to deal with that, because we like positive outcomes. Everyone loves positive outcomes, and there weren't any at all. Yeah, go ahead.
No, I just was going to ask you, given the fact that there were no positive outcomes, given the devastating processes of dying when one was infected with HIV/AIDS, how did you take care of yourself in order to also then take care of others?
Well, I have to say we drank a lot.
I think that's a good thing.
um, we, I guess it was partly I guess a few things. It was partly, it was a great deal of the camaraderie and just the sense of empathy that we all had with each other. It was also the feedback from the people that we helped. They were so grateful. They were so loving. I mean, their loss was made greater by that fact, but it was that part of it as well. And that kept us going. I mean, burnout did happen. People would just stop coming to work because they couldn't take it anymore. And then they'd come back, but you needed to get time away, although you couldn't be because your friends were, getting infected and dying too. Right. So it was, when I look back at it, Richard, I don't know how we all got through it, really. Those are the few things, but I think we felt that we were on a mission that was good. That was really it. And we could mitigate their suffering so much. We didn't have to see somebody dying on the street. We didn't have to see someone who worried about their rent payments. We could take care of that for them. We could get them health insurance. We could really build up, a real support system for them in every way. And then they had, the gay men's health crisis. There were a lot of agencies that came into being after that. Well, gay men's health crisis first. After 1986, a lot of other AIDS programs developed and came to the forefront. But what was sad was that the traditional social service agencies that existed were not equipped to handle people with AIDS. They didn't want to. Right. So that's why a whole different social service delivery system grew up around HIV/AIDS. And of course, people would say to us finally, well, people with cancer don't get what you're giving to your clients. What makes them so different?
How do you answer that?
Well, we answered it by saying, well, you treated our clients as lepers, and you didn't build any system for them. Otherwise, they couldn't access any other systems, and that's why you had to do it. When people with AIDS identified themselves as sick and walked into a welfare center to apply for assistance, the fear was so great that no one would touch the piece of paper that they filled out to get assistance. So it was clear. I mean, if a person with cancer had walked in, it would have been okay. It was a whole different thing, but they couldn't get any services, So that's what I told people.
Well, and justly so. The agency that you worked for, is it still functioning?
Yes, it is. It's still functioning in a somewhat different way. When I left the program in 94, we had 15,000 clients. I'm not sure of the numbers today, but there's so many more people living with HIV/AIDS in New York City now. And I know they service a great deal of them because they still give rental assistance so people can remain in apartments, and they're in access to different kinds of services. So yes, it still exists today.
And how is it funded?
Through state and federal and city funding.
Okay.
It's a triple effort.
Right.
So.
Right. Okay. And where were you located?
Well, I was located, we had offices, but when we first started out, we were located just one office in Manhattan in a welfare center on 14th Street. And that again just showed how people felt about it. We were given one side of the building. They built up a wall to separate us from the other staff that weren't part of the program. They did a whole different kind of air exchange program. So nobody would breathe the air that, our clients had breathed.
So two separate HVAC systems.
Yes. And when we needed repairs done, and thank God that stopped soon enough, people came in hazmat suits.
No.
To do some kind of repair in our office. So that was the kind of thing that went on probably the first year or so.
You know, as you tell me this, I should not be shocked, and yet I am. But it wasn't that long ago.
Not really.
Not really. I mean, I find so many people today either blissfully ignorant or willfully unaware. And I'm like, but I was alive then. With all my students, I was like, I was your age then. This was real. I lived through it. I was 20 when that happened, or whatever.
Yes.
And so yeah, it wasn't that long ago. But you know, it's curious how we as a society want to forget those things.
Absolutely forget it. We don't like to expose how we treated people, or, you know, anything about that time, except, you know, that we finally were able to treat it and people got better, and that was the miracle, and everything was good. But those years before, they were not good.
Right.
And people don't like to remember that time, or remember what lessons it could teach you to face another crisis like that.
Right. Before we segue into art, do you have anything more you'd like to say about those experiences?
Actually, just a couple of general things, and I just mentioned, because I have to mention, and President Reagan, who never mentioned the name or anybody who died of it or anything. And so that lack of national will was quite extraordinary. The other person, certainly Dr. Anthony Fauci, who was from the beginning this calming, decent influence, you know, who didn't adhere to the principles of morality. He was a scientist. It mattered to him what was going on with the epidemic. The CDC would have weekly briefings on COVID. I think they called it morbidity, the MMW report, morbidity and mortality report. So they kept people abreast on what was happening. The CDC does nothing today. We get nothing from them. I mean, they issued the guidelines on, you know, how to protect yourselves and that kind of thing. They did that. Today they're missing. They're MIA. And Dr. Fauci, although he was a focus of great animus initially from AIDS activists, because he was the face of science that wasn't doing anything for them. But he was the one who basically listened to them, talked to people. He started that separate track for people. He changed the whole way that drugs now are tested and approved. It shortened greatly, although you would say that since fully 15 years after was the first time we got a treatment, I guess that could be considered short. I don't know. But he certainly became then the face of decency, I would say, in an administration that had very little. So he was an excellent one. And then very directly, because of New York City, Edward Koch was the mayor of New York City. And he ignored it for years until gay men's health crisis was constantly agitating and really in his face. He had to deal with, and a homeless crisis was brewing, and the hospitals were screaming at him because they were losing money because they had to keep people in hospitals because there wasn't any place to put people with AIDS if they had no housing. Right. So he was forced to act, and his statement, or one that's attributed to him, was, all right, do what you want. You can have this program, but don't let anyone die on City Hall steps.
Wow.
That's all he asked.
Wow.
And I have to say that the benign neglect that the city showed to my program really helped us, because we could do a lot of things that people were afraid to tell us not to do.
Right.
And they didn't, scrutinize us too much in those early days. Later, they looked at us a bit more because when people were dying quickly, the city felt they could, when the state, that they could invest a certain amount of money. It wasn't going to be over years that this money would have to be spent. But when people started living longer, that was a whole other issue. There was a lot of money then that might be spent, and we needed to look at things on how we ran this program and what we did.
Oh my gosh, it's all so predictable.
Yes, it is. Yes, it is. But those first few years, I mean, it was the horribleness of the disease, but what we could do was amazing.
Right. No, it is quite impressive. I mean, that's one of the inspiring lessons of the AIDS pandemic, the way certain communities pulled together and formed political action and
Absolutely.
and took care of each other. Yeah.
Yes, yes. And really, what the role of ACT UP, the role of gay men's health crisis, I mean, some of the things, I mean, taking over the New York Stock Exchange, I mean, these were incredible performance art almost. And that's because it was so filled with artists and actors and all of these creative people who are now lost to us and died too young, but they could do this. There was one that perhaps was a little iffy, and that had to do with the Catholic Church and Cardinal O'Connor.
Yes, you mentioned this in an earlier conversation.
Yes. Cardinal O'Connor was very polarizing at that point. He was, on one hand, he told people to love their homosexual children, they should love them. On the other hand, he used his pulpit to talk against people who were gay and safer sex practices. He used that pulpit to be totally against any of that. And so the Catholic Church was opposed to anything that would mitigate the suffering of people with HIV/AIDS. On the other hand, he would spend weekends and nights at St. Clair's Hospital, which had become an AIDS hospital. And he spent a great deal of time there, even washing people, feeding them, being there with his other priests. So we had this kind of duality. But the public face that people saw and got angry at was the one that railed against homosexuality.
It seems so difficult to reconcile those two.
I know, totally. Well, the Catholic Church, caring, but dogma, it was right there. And then on December 10th, and I forget the year actually, December 10th, 1989, it was, I think, Sunday Mass at St. Patrick's Cathedral, and about 4,500 people participated in a demonstration. They were outside primarily, but certain people from ACT UP went inside. And when it came time to receive communion, one activist took the host and crumbled it up and threw it on the floor. And that became, no one apologized because these were terrible times, but it affected, people who were in the church who view the host as a sacrament. And for this to have happened was very difficult for people to reconcile with. Mm-hmm. So, but as the people from ACT UP said, I have no judgment on it really. It was sad. That's what I would say. It was sad. But that was how the Catholic Church, particularly in their teachings about that, no safe sex, that kind of thing. It was very difficult to deal with them.
Did you know people in that protest at St. Patrick's?
I did, yes. Not the person I don't know the person who did that, but yes, I did. And many of them were, some of them were clients, and some of them were Catholics. So,
right.
It was interesting. And the other thing that the Catholic Church did, and this was Mother Teresa. Mother Teresa sent a group of her nuns over to New York City to open an AIDS hospice. So these wonderful nuns, you know, from India came over and took in, you know, people who were homeless. They were, you know, they slept on mats on the floor, and they were nurses and they cared for these people. It was quite remarkable.
Such curious contradictions.
Yes, yes, absolutely, absolutely.
Wow.
What we saw.
Right. Well, I wonder if now would be a good time to maybe transition to talk about some of your friends and their artistic responses to their
Yes.
lives.
Well,
and so, just to inform people that what I mean by this is we're going to talk about David Wojnarovicz and Peter Hujar and Anita's relationship with those people and their art. So
yes, well, as I met I met David through my friend Tom, who he and David met in the first day of 1986 and became lovers and were together until David's death in 92. And it happened that on January 6th, I became head of the AIDS program. So somehow this all kind of came together in ways that we never ever anticipated. I remember Tom laughing with me and saying, "Oh, well, that's a good job for you. If I ever need you, you'll take care of me." I said, "Sure, why not?" Not knowing what this would all lead to.
right. Life is full of those fortuitous accidents.
Exactly, exactly. Now, David kept his artistic life somewhat separate from his life with Tom and then his friendships that developed with a lot of Tom's friends. So Tom didn't need all his artistic friends. But, and this is a little cute, not, well, maybe not cute, but when David started talking about his great friend who was a photographer and going on and on about him, he didn't mention him by name. And Tom, I remember Tom calling up and saying, "I just know this is Peter Hujar. I just know it." He didn't say his name, but I know it. Tom had had a relationship with Peter Hujar several years before that. And he says, "Just know it's him, and I hope he doesn't tell him anything bad about me." And actually, Peter was quite supportive of the relationship, I have to say. He felt Tom was a good influence on David.
Oh my gosh.
So I hadn't met Peter, but Peter became ill in 87, the end of 86 actually, and was in the hospital. He had pneumocystis pneumonia, and he was a real curmudgeon. Anyway, while he was a magnificent photographer, he didn't make much money on it. Again, his works have become more valuable since his death, but he didn't have much money. He relied on, you know, various people and various things, but he didn't have any steady income. He had no health insurance. He had rent to pay. It was going to be very hard. So David asked Tom if I would help Peter, and luckily I, you know, was there and I could do it. So we never had enough caseworkers to serve the clients that kept coming in. And so some supervisors and myself, we took on a caseload. So I said, well, all right, I'll go out and see Peter. And that became a friendship that lasted until he died the end of Thanksgiving Day in 87. And David and I bonded because David was his favorite person in the world. And no matter how miserable Peter was, David could always be with him and take care of him. And no matter how miserable he was, Peter knew that I would help him out for various things to get him out of a hospital or whatever. So he was nice to me as well.
Right.
And in the beginning, Peter had his own way of dealing with things. He never took another photograph after his diagnosis. Well, so for a year, that last year of life, there were no photographs from him. He had his own way of dealing with it. He went to a doctor who helped cancer patients who had like a little AIDS practice. And so he was drinking his own urine and getting injections of peculiar things. But again, there was no anything. So why not try? And then he dragged David and me out to a doctor in Long Island who believed that by giving weakened typhoid shots to people, you would stimulate the immune system to do a response and that you could eliminate AIDS. Well, that didn't work either. But
they sound sort of like current theories of how to cure coronavirus.
Exactly. The sadness for me is that when we went to see this doctor, the waiting room was filled with young men, and many of them were clients in my program. And they all were seeking, it was like the Pied Piper. They all were seeking some kind of cure, something that would let them live longer.
Right.
So
clearly desperation drives people to these things.
Absolutely, absolutely. The thing about it too was, what did they have to lose, really?
Right.
They were losing their lives anyway. It would be over fairly soon. One of the other mantras of the AIDS epidemic was, stay alive until there's a cure. And for many of them, it didn't work. My friend Tom, it worked. After David died, he was getting sick himself, but got into a drug trial, and that saved his life. But, again, there weren't any drug trials, so after David died.
Right.
Now, David, on the other hand, we were, even while taking care of Peter and getting sick, he and Tom did not want to know their status. When Peter died, Tom decided he wanted to know his status. David waited a while longer to learn that, he was positive as well. But David was becoming more, although I don't know how much more passionate he could become, but he was becoming, his art had a greater sense of urgency, of passion. He wanted the world to know how the government was, again, murdering people through their inactivity and their unwillingness to help them, and how the homophobia was so enormous that, as he says in that beautiful, This Little Kid, that people will treat him just differently just because he wants to kiss, another man.
Mm-hmm.
And so David's art really started concentrating about AIDS. He did this extraordinary installation of a lazaretto. Have you heard of a lazaretto?
No.
The lazaretto was like in the 1500s. The lazaretto was a quarantine, and it was a maritime quarantine. So people would be quarantined on ships, like lepers or other people that people were afraid of for contagion purposes. And so it was actually, leper houses were known as Lazar houses, and run by by priests and religious orders. So David did an installation, and it had this boat, and his three people that I would say that he directed a great deal of animus against were Cardinal O'Connor, Jesse Helms, and President George H. Bush.
Right.
And so these three figures were in this boat that was part of the installation, looking like ghouls in a way, and expressing the horror of what they were doing to people. And the rest of it, was like the way people with AIDS lived and how they suffered, that kind of thing. So it was really very interesting. There are pictures of it on the internet.
I will look for that and put it into the module. Yes.
Okay. And then David always, and I'll read this because it's so much of it. David always, his childhood was so terrible, and he was forced at such an early life to sell himself on the streets and to suffer poverty and disregard and hatred, that as he was able to do his art, he expressed this, what he felt about poverty, abuse of power, blind nationalism, greed, homophobia, and the devastation of the AIDS epidemic. That's what his art expressed, and expressed so eloquently. And it wasn't only his art, it was his writings that in a way sometimes are even more eloquent. I don't know where he got the time, because he was traveling. We all traveled together as long as we could. He went different places for different kinds of shows, but he was constantly creating art in his brain, constantly. It was amazing to see and to be with him as he was looking at images and kind of trying to arrange them in a way that would make sense. He was just an extraordinary character, very gentle, very sweet man. His anger was quite extraordinary, which I think comes out in his art. And he railed against his disappearing. He did some kind of, some short films, where it talked about his death, and he talked about it in a way, in a very, even tone, kind of separate from it. But when he would come to visit me at my job, because he didn't live too far away, we would sit and talk, and he'd talk about the latest infection that he had. And he'd get a tone in his voice that was so painful to listen to, because he knew that there was something going on that he couldn't stop. Right. So that's why the urgency of doing his art like that. And his art resonates today. They did something on PBS last week, and they showed art, a small bit on art in epidemics. So they showed Edvard Munch, not only the screen, but he did a self-portrait of himself with the flu, which he did die of. And they had
have a module about Edvard Munch.
Oh, really?
Yeah. Uh-huh.
And so they, for David, they showed the triptych that he did of Peter, that he had taken of Peter after Peter died in the hospital. And he did these photos, and they showed that as something. David was, while he was anti-formal religion, which he felt were so homophobic and against people, the images of the church were very important to him. He did, when we were in Mexico, he found driftwood and made these 3 crosses, which hang on the wall here, which I cherish. He did many crucifix and Christ-like photos. I mean, the one that got him in trouble at the portrait gallery was the one that had ants going over it, which is offensive, but some people found it so. But he used a lot of that imagery in his work. Mm-hmm. So he used all kinds of he had a whole box of different kinds of trinkets and things. It's now at the Fales Library, actually, at NYU. If anyone wanted to look at the source of a lot of David's artwork, and a lot of the little things like little babies and little eggs and all kinds of little animals, David used them again and again in his art. So one could go view them there.
That's wonderful. I did not know that, actually. Mm-hmm. What is it like to live in an apartment decorated with all of these things?
It's kind of daunting. I inherited, Tom was sick for a while, not with HIV, but with other things. And so I was here I took care of him essentially. And I lived here in the midst of my own issues. So I took over the apartment when Tom died. Tom had accumulated many famous photographers did photos of David. There's a photo that Peter Hujar did, a photo that Nan Golden did. They surround me. There's also a painting that no one's ever seen, I think, that David did for Tom, a huge tornado in the dark. It's quite something. So yes, I'm surrounded by this, and kind of embraces me. I feel them. I talk to them. I talk to Tom and David. And
That's wonderful that sort of like living in a gallery, I
in a
suppose.
way, yes, yes, but with things that have, great meaning in a way,
Right.
So I have I have a copy of the Buffaloes here. I have, which I call Untitled. I have Face in the Dirt, and a myriad of
Uh, well, I remember very much how impactful it was for me to walk into the Whitney exhibit of all of David's work,
yes.
and well, you live like that.
Yes.
So I wonder if I want to eventually go back to ask you things about Cuba and Mexico in just a minute, but first I wonder if you want to say anything about a couple of these paintings, or sorry, of these images.
I know that David, the one that's up right now, Face in Dirt, David set up that photo. He was it was right before he became really sick, and he was out in I'm trying to think where he was, in New Mexico or Arizona. And he wanted to show his disappearing, that this is a person who will be gone soon. And that's what he wanted to show in that image, pretty much. It's someone else, make the photo of it, but he set it all up.
Right.
And
It's so interesting as a self-portrait, but also kind of looks like a death mask. But
yes,
also,
absolutely.
there's so many. The image is in stasis, but there's so much movement,
Yes.
and
Yes.
I just find it so interesting, and also that it's basically on grayscale too.
Mm-hmm. David had the most wonderful elastic face. He could contort it into all kinds of things. It was amazing. So you see the life in it, no matter what,
Right, right. No, very evocative and very.
Yes, yes.
Not quite. I was going to say haunting, but I don't think that's the right word. It's just very present.
Mm-hmm.
Yeah.
Yes, yes.
And this one, which served as my background today, I think this may be my favorite one.
I think everyone should have a copy of this. I just think it has such meaning in what he says in this. I mean, here's David. This is him. This is him as a little boy.
You can tell from his teeth from the previous
Yes,
image. You can tell it's the same person.
there he is. And there he is. And it just tells. It tells the experience of when you're gay, what's going to happen to you. And as you said, Richard, sadly enough, it's still going to happen to this day in different places, or not even in different places, anywhere.
Anywhere. I like this image a lot because it speaks on such a personal level.
Yes.
And yeah, it makes me cry also. It's because it's such a visceral
Mm-hmm.
narrative, and yet it's also so very short. And the image of the child is
Yes,
happy and hopeful and
exactly. Innocent, an innocent child who is going to be not destroyed exactly, but will be stigmatized and be hated for one reason. One reason.
One reason only.
Having nothing to do with his character, who he is, anything like that.
And I also recognize myself in the image. I mean, I have pictures of myself, young before I was aware of
Right.
myself, and the same kind of, big front teeth kind of thing going on. And
Yes.
wow, if only I could go back and talk to you.
Trying to figure out who you are, what you're doing in the world, and that kind of thing.
Right, right. But no, it's beautiful. I mean, it's very sad and anger inducing, but there's also beauty in it.
Yes, very much so.
Power. I feel maybe that's the thing that calls me to his work is yes, there's anger and sadness, but there's a sense of empowerment in it too. At least that's how
No, David believed very much in that. You know, he believed in truth, and he believed that you should offer no excuses for who you are, for what you do.
Right. I also really love this one.
Yes.
Oops.
Yes.
Oh, shoot. Sorry. I'll go back.
Well, everyone should read his thoughts rather than my thoughts. I mean, those are the ones that he's put down. But this one, this magnificent photo was taken in the Smithsonian from a diorama that when Tom and I and another friend went to see it, this was after David had died, we couldn't believe that he did this magnificent photo from this dinky little diorama. And it was essentially about that the Indians, the Native Americans, would chase buffaloes over cliffs. And I guess at that point then get them later. But that was the whole gist of that. And David just turned it into a metaphor, you know, for life. This is sometimes the futility, you don't know what's going to happen. It's a remarkable photo.
No, it really is. Yeah. No, go ahead.
No, you go ahead, because I think what David talks about is kind of interesting about how he.
I'll move to that slide in just a moment, but I find this image so striking, and you know, I live in the city of Buffalo, so I see lots of imaginary buffalo around. But I also it strikes me as a metaphor for our country, and for our political leadership of driving us off a cliff, and it feels like that far too frequently.
And these are strong animals, you know, these are big, strong animals, and there they go over the cliff.
Right.
No one's going to rescue them.
Well, here we have David's own thoughts on it here.
Yes.
Sorry.
People should just read it, I think.
Yes, I think so. But I'm so glad that you provided a copy of this for us, to have his own sort of words.
Yeah.
About
everybody has different thoughts. You know, everybody has thoughts, but these were David's.
Right. I found it interesting, his use of how you just turn the TV on and you're transported, and that has changed, it seems to me.
This one.
Yes.
He did something else with a loaf of bread first that was sewn. Kind of
you know what? Yes, now that you say that, I remember seeing that.
Yes. And then he had another, Andreas Sturzing, another photographer, took this picture of him. Again, silence equals death. His lips are tied shut by society and hatred and that kind of thing. He's angry in this one.
Oh, definitely. Now, did he actually pierce his?
No.
I want to ask you your thoughts on this, but I see this and it's hard for me not to think of our current moment and masks.
Yes.
And I wonder if you have any thoughts on that, and I don't want to play the game of what would David think, but but it's curious to me to think about the correlations and choices, maybe. And you know, we're living in a moment where people are adamantly and angrily refusing not to cover their mouths.
Right.
And I find that juxtaposition with this image so fascinating.
Right. I was trying to think what David would do. I don't know. Uh, you know, I can't talk to the intimacy that he and Tom shared, but I do believe that they used condoms at some point, you know, because even though they were both infected, it seemed like the right thing to do. I don't know. I don't know. Certainly he wouldn't, all right, I would take it from this angle. David wouldn't want to hurt anybody else. So if wearing a mask meant that you don't hurt anybody else, yes, that would be, I think, the governing factor there. And certainly when they tell us to wear a mask, it's to protect other people from us. And I believe that that would be David's governing factor in that.
That's what I think I find so curious about the current mask debate is
Yes.
the rupture of the social contract.
Exactly. I don't know why they don't, well, Dr. Fauci tries to. He tries to tell people you're protecting someone else by using a mask. And then you hear these people saying it's my freedom not to use a mask. It's just like those people who say it's my freedom not to get a vaccination.
Right.
I don't care if I infect, it's my right.
Right.
So not thinking about greater society or your fellow neighbor or anyone else or your grandmother or your, you know, that kind of, that's the same.
Yeah. You know, it's from my perspective a very selfish.
Absolutely. Absolutely.
Yeah.
Yes. Yes. We're a country where, you know, people believe their individual freedoms are greater than being, you know, decent to saving other people. That's.
So here we have the triptych.
Yes. Yes. Yes.
Which I did not put on the same slide, but I.
Right. It didn't come to you.
Yeah.
Right. So this is Peter at Cabrini Hospital. It was Thanksgiving Day, 1988, 87, sorry. I was there, David was there, and another friend, Ethel Eichelberger, who has also died of AIDS, was there. And, you know, we were sitting there. Peter was not awake. He was, I think, in a coma or, you know, just comatose or whatever. And all of a sudden, Ethel says to us, oh, I don't think he's breathing anymore. This was kind of mid-afternoon. And of course we went over and he had passed. So David kind of said to me, could you keep the nurses out? And I want to take some pictures. So we left the room and we left David to take pictures of Peter. And this is what came of it. He looks, it's almost like a Christ-like, you know, a suffering kind of picture. And then he took his hands and his feet as well.
And there we have the hand.
Yes. And it was amazing. Once he had finished that, we called people who immediately came over. Peter was great friends with so many people in both the literary and the art world, and people he had hung out with at various, the Danceteria and the area, various kinds of clubs. Peter was well, not later in life, but earlier on. So people like Fran Lebowitz came and, you know, quite a few other people, artist friends, and we all gathered together at Cabrini, you know, to say goodbye to Peter.
Right.
And then Tom, David, and I went out for Thanksgiving dinner.
Well, life is like that, though.
Yes.
I think
Yes.
we tend to forget that.
Yes, and Peter, who was raised Catholic, but of course, you know, did not follow the faith at this point. He and I had a chat during one of my visits to him about what he wanted when he died. And he kind of said to me he wanted to be buried in a wooden box, wrapped in a linen cloth, and he wanted to be buried in a Catholic cemetery.
Oh, really?
Yes, yes. And so we had written it down, and I had, we'd put it away and I'd forgotten it. And they were planning to, I think, bury him in New Jersey or whatever. But they came upon the writings and they called me and said, oh, I said, yes, I did this with him. I think it was on Columbus Day. We wrote this up. And so they buried him at a Catholic, we had a Catholic mass at St. Joseph's in the Village. And then we buried him at Gate of Heaven Cemetery, a Catholic cemetery in Westchester County, outside of New York City.
Right, right.
And David made a beautiful angel stone for him. He designed it.
Oh, wow.
Yeah, yeah. I've been there once to see it.
Uh-huh. Wow. I think I'm going to stop the screen share and then we can continue our conversation. Is that all right?
Sure.
Okay. And there you are. So thank you for sharing your memories of these people and a few pieces of art that that you live with also. I wonder, I guess I'm trying to formulate a question here. What is the relationship between art and suffering that you saw, particularly through these people, David and Peter and so forth?
It can depict a moment in time that stays with you forever. So many things are transitory. Memories can be transitory, but there it is in art. And so David's feelings and thinkings and emotions are right there in front of you, and you see it, and it does something to it, transforms you in a way, and for people seeing it, it gives them a new way of thinking about things, perhaps, or looking at things. Like, even Keith Haring, the artist who also died of AIDS. I mean, his work today very much in the modern mainstream of life and everything. He also resonated with people. David resonates on a different level, perhaps. Very powerful level. And as I said, his writings do the same. They're personal, and yet they also depict a time, a moment in time of suffering and his own personal feelings about it. They're kind of like, he rips himself open in a way.
Right. Do you want to talk about A Day Without Art?
Oh yes,
the AIDS quilt.
Yeah, there are certainly. The Day Without Art was started in 1989 when there's a group called I never get this right. Visual AIDS is an organization. It's based in New York City, but they provide support to artists with AIDS. And I think they were perhaps very instrumental in starting this Day Without AIDS that now occurs every year, starting in 1989. And that's when the galleries are closed, no one can go see art, and is to show the respect that one should have and the reflection that one should have on what happened. And it always around World AIDS Day, which is another certainly important event. I hate to say event, it sounds cheerful, but it's a way of commemorating. That's really what it is. And then the Names Project, which is the AIDS quilt, which I think now fills 6 football fields if you laid it. Sadly, Tom was always going to do, David did a piece for Peter, and he and I went to see it on the Great Lawn in, I think, 1989, so we were there. And then when David died, Tom, everyone thought Tom was going to do it. But Tom got very sick himself at that point. And as I said, then got into a drug trial and things got better. But somehow, and then he had some other issues and whatever, it never got done.
Oh.
So one of my goals, in fact, we were nearing completion. I had gotten a group of people together, some of David's artist friends and some of Tom's friends as well. And we were doing one for Tom and one for David. And we were just almost there when the coronavirus pandemic hit.
Oh, no way, really?
Yes, really.
Oh, gosh.
Really, really. We were just about to sew perhaps the last photo on it.
Oh, no.
So it's an unfinished work at this point, but as soon as we feel safe enough to get together, we will finish it. And hopefully we'll be able to show it at the PPOW gallery first, where who represent David's work, and then get it off to the Names Project.
Oh, that's so wonderful.
Yes.
I hope that I would be able to see an image of that.
Oh, absolutely. I actually can send you some, Richard.
Oh, that would be fantastic.
Not done yet, but I can.
Oh, I would love that so much. Thank you.
Okay. Definitely. So,
well, I want to tell our listeners that there is another module about the AIDS quilt that if people are interested in learning more about. There's also a module about a photographer who has photographed AIDS and AIDS activism and the COVID situation as well. And there's some very interesting module with Philip Clark and Christopher Bram about literature and AIDS. So if people want to pursue some of this more from other perspectives, those are other modules that are available. Anita, it's been such a delight to speak with you. I'd like to give you an opportunity to add anything else you'd like to say as we draw our conversation to a momentary close.
Yes, right. Well, I do want to thank you, Richard, for giving me this opportunity, and actually for my friend Towns for making this in a way happen.
Oh, absolutely, yes. A definite shout out to Towns, because none of this would have happened without Towns.
Yes. And it's been a long time, and one gets caught up in, daily life and whatever else happens to you. But this was such an important, momentous part of my life that kind of defined who I am and who I wanted to be. Wasn't, like I said, always perfect, or, we made all mistakes and things, but it certainly enabled me to see another dimension of life, to learn from people, to feel the energy of people, to see the dignity and the extraordinary power of people whose lives were going to be cut short, but who had so much still to give during that time, be it love, be it friendship, be it neediness, whatever. They were humans, and it was, as I always say, the best of times and the worst of times. And that's how I think most of us felt about it in the program.
Do you feel then that those were lessons that have helped you in this current crisis?
Yes, I think it has. I mean, I certainly, we understand the need to protect others and to take care of others no matter what. I certainly empathize with all of the healthcare people who are, giving their lives on the line to take care of people. I understand, because once they got over the fear of transmission, they were dedicated to taking care of AIDS patients, even though, again, the outcome was not going to be good and they were going to die, which for many doctors and nurses is a terrible outcome. We want people to get better. So it's understanding that. And it's, again, getting so angry at the government and that response and these people who are blind and ignorant and not even uncaring, but they just don't know how to deal with this kind of thing when they should, when they have the power to do it. I think that's more my issue, I think. They have the power to change things, and they're not doing it.
So what message of hope or strength or perseverance?
Well, perseverance is number one. As New York City slowly opens up, I had lunch for the first time outside with one of my friends, who was also a friend of David's, and another artist, and we had lunch outside, and that was such a wonder. It was like a gift. It's been so tentative about going out or enjoying anything in life, and just this little bit, but we were careful, and you can't hug each other, which is like another terrible thing.
Well, that's so hard for me.
No, I know. At least I would say with my AIDS clients and patients, we could hug each other, kiss each other. I mean, it was
right.
Hold each other. It was, that was the important thing, and you can't do that here. So
yeah.
But you have to cherish what you can. That's
right.
really. And I do believe, science has progressed. There seems to be a great will to develop a vaccine or at least better treatments. This will be a rocky thing. Things won't work. We have all kinds of forces against us. The anti-vaxxers, who won't take a vaccine for anything. We have all kinds of people who have their own axes to grind. But science will move on.
Right. And so will we.
And so will we, exactly. And we will learn how to live with this. We will learn how to be human and continue to be human with this. And I think that perhaps is what the AIDS epidemic really taught me, how to stay human in the midst of horror and fear and prejudice.
That's a beautiful note to end on. How to stay human in the midst of horror and fear.
Yes, that's what I learned.
Well, Anita, it's been such a pleasure, and I look forward to a socially distanced and safe lunch with you in the near future.
Absolutely, Richard. I do too. Thank you. I feel like the time, I don't know how long we've been doing this, but I feel like
the time flew by. Thank you so much.
Thank you.